Got a guest coming in right now who's an audiologist, and we're going to talk about the tie-in between hearing and your mental health. And so as we say goodbye to Miss Kayla, have a great day, Miss Kayla. And then we're going to pull the other young lady in. Jacob, if you could do that for us. I think she's waiting, Miss Haley, Dr. Haley. Then we're going to talk about this. And it's important. It's all a part of mental health and how it plays into your role. So Dr. Owen, an audiologist at Livingston Hearing Aid Center, and we're going to talk about the importance of hearing today. Good morning, Doctor. How are you doing?
Good morning. I'm wonderful. How about yourself?
We cannot complain. Thank you for joining us this morning on the chat.
Absolutely.
Dr. Owen, my first question to you is, why is hearing so important, especially in deference to mental health?
Hearing connects us to the world around us. It's, conversation. We're, humans. It's how we're different from the other animals. We communicate. With mental health, being isolated leads to depression, social isolation, ultimately can lead to cognitive decline and even dementia.
Okay. Well, as far does that mean that, like, the loss of our hearing well-being or overall well-being altogether, or what?
I mean, I'm not a mental health expert, so I couldn't say overall health, mental health well-being overall, but I mean, it definitely plays a role.
No, Doctor, why are people at an increased risk for developing dementia if they don't treat their hearing loss?
Ultimately, it comes down to cognitive decline. So the more the brain doesn't process the sounds getting up to the brain, the more it forgets how to put sounds together in a meaningful way. People with hearing loss also tend to self-isolate.
Mm-hmm.
They have a harder time. It's just more difficult to communicate. So it's easier just to kind of stop. Mm-hmm. So a lot of times they'll just withdraw and kind of self-isolate. And the less social stimulation we get also leads to that cognitive decline as well.
And how does somebody know if they have hearing loss?
Usually it's going to be a family member that's going to notice it first. Hearing loss is a slow, gradual process that happens over time. And a lot of times the person with hearing loss, in the beginning stages isn't really aware. So it comes down to family members just kind of watching out. We'll see people starting to ask for repetition more often. Maybe they're turning the television up a little bit louder. Mostly, though, they're going to say things like, I hear you fine. I just can't really understand what you're saying.
I feel that coming on.
Just out of curiosity, how can families, especially immediate families, help with those who may be experiencing that hearing loss?
Patience and kindness. A lot of people don't necessarily want to admit or own hearing loss because it requires them admitting and owning to getting older. So just, being patient, being kind. You might start a conversation like, hey, Mom, I've noticed you're turning the television up a little bit. Maybe we go get your hearing tested and just see where we're at.
Mm-hmm. Let me ask you this, Doctor. I know with the pandemic, I had a hard time with the mask because I didn't realize how much, because my hearing is bad, I'll admit to that, but how much I take social cues or understanding someone from their expression, from their eyes and that sort of stuff. Did you see a rise of people coming in to get examined for hearing loss during the pandemic?
Absolutely. We've seen a significant rise in people noticing even mild hearing loss. So, we depend on facial cues, lip reading. The mask itself actually acts as an acoustic filter as well. So to some degree, it really is blocking sound. But people who have a mild hearing loss that maybe were getting along just fine, the masks have really kind of made this, more difficult for them. So they're coming in more often to get their hearing tested to kind of find out, is this really a hearing loss or is it just the masks? Social distancing has caused there to be actual physical distance, which causes some issue there as well.
How would you prepare? How would you prepare a child or parent or even yourself to go to a visit to the audiologist?
I would start by making a list of the places you've noticed having difficulty. Most people start noticing hearing loss in noisier environments, maybe at the restaurant. If you're starting to have trouble, understanding what the waiter is saying, that might be an indicator of mild hearing loss. Now, everybody's going to have trouble in a noisy environment, so it might just be a normal, I have trouble in noise. But it also could be the beginning stages of a hearing loss. And we know that the earlier we can treat a hearing loss, the better the outcome is in the long run.
Now, is there a common question hearing loss patients usually ask?
Yeah, most of my patients at Livingston want to know the cause. And ultimately, it's very, very difficult unless there's a thing, an incident, a story. I have this one time, a firecracker went off and, my hearing immediately was lower at that point. Most of the time, we can't really figure out exactly the cause.
Yeah.
We can add things together from your story, but most of the time hearing loss is a cumulative thing that happens over time. It's a little bit of noise exposure. It could be a little bit of genetics. It could be a little bit of just getting older.
Now, I know this might sound funny to some people, but I think I've reached the age where I've reached the point of selective hearing in deference to hearing loss. But there is a big difference between those two maladies, if you will, is there not?
It is true. I can make you hear better, with hearing aids, but I can't make you listen.
Oh.
That's all of us. We feel that way every day.
What did you say?
I know it. Yeah. Now, Doctor, final question for you: how often should we get our hearing tested? How often should we get to
At Livingston, we recommend annual hearing testing, usually starting at the age of either 65 or when you start noticing that you're having some trouble. If you get your hearing tested and there's no hearing loss, that's wonderful news, and we'll just test it again in another year. But we definitely know that treating a hearing loss sooner ends in better outcomes. The hearing aids actually work better if we can treat the hearing loss earlier, and we can actually slow down the progression of the loss. So waiting is usually not your best option.
No, Dr. Owen, how can they get a hold of you and schedule an appointment?
So our office is at 1600 Coulter Street. So you can come by there. You also can go to our website. It's lhac.com. It's at livingstonhearingaidcenter.com.
Wonderful.
That is great. Now, this marks Better Hearing Month, and this would be a great time to stop in. Make it a yearly thing that May, when you get to the month of May, that's Hearing Month, and you can go get your hearing checked out. It's important. From 8 to 80, it really plays a role in development. It can affect your psyche. We just talked about how dementia kind of rises because people shut themselves off, and it's a lonely existence for people who have hearing loss or issues with hearing. Number one, they don't want to admit it, and number two, they worry about, I don't want a hearing aid. But there's nothing like hearing the voice of your loved ones. So
that's absolutely true.
That's it. So go visit Dr. Owen there at the Livingston Hearing Center, Aid Center, and celebrate Better Hearing Month this month. Thank you, Dr. Owen. We really appreciate you stopping by. We'll grab you again here probably in a month. 4th of July is on the way. A lot of noise, a lot of loud things going on. So we'll talk about that next month.
Sounds great. Thanks for having me.
All right. Have a great day, Doctor.